is coming from the audience, and it's right here in front of you.
My name is Bill Grove. Too many older adults are struggling to afford their life-saving prescription drugs. My prescription drug costs have doubled in the last few years. Fortunately, that increase has been manageable for me, but that is not the case for many other older Iowans. Too many make tough choices like filling a prescription or buying food for the week. If elected, what is your plan to make sure Americans have access to affordable prescription drugs?
Bill, thank you very much for that question. You know, in Washington, D.C., there are a lot of selfish, greedy, dishonest entities. But I have had a hard time figuring out whether it is the pharmaceutical industry or Wall Street, which is the worst. Not quite clear, but I think it may well be the drug companies. All right, and let me tell you why, Bill. Last year, the top 10 drug companies made $69 billion in profit. How's that? Not bad, $69 billion in profit, while 1 out of 5 Americans cannot afford to fill the prescriptions their doctors write. Think about that. When we talk about a dysfunctional, irrational healthcare system, how insane is it that you go to the doctor because you're sick, doctor writes out a prescription, you can't afford to fill it. Well, what happens? You get sicker. You end up in the emergency room at greater cost to the system. So what do? First of all, we make it very clear to the drug companies that the day is over now, today. First day as president, they're going to stop ripping off the American people and charging us the highest prices in the world for prescription drugs. 20 years ago this year, I took a busload of women who were dealing with breast cancer in northern Vermont across the Canadian border to go to Montreal and buy tamoxifen, a widely prescribed breast cancer drug. Take a guess, Bill, the differential in price between Canada and the United States for this breast cancer drug. Well, it was 10 times. And I remember, we'll never forget, women were crying. These are working class women were crying that they were now paying 1/10 of the price. In a week, I'm going from Detroit to Windsor, Ontario, with a group of people to buy insulin because they have diabetes. Once again, the differential will be 10-1. They're going to pay 1/10 the price in Ontario than they pay in Michigan and in the United States. So this is what we are going to do. First of all, under the Medicare for All proposal, which I've introduced, we do what the United Kingdom does and what other countries do. We cap the amount of money that people will spend for prescription drugs at $200. Why is that? Because when you talk about healthcare, you've got to talk about prescription drugs. You can't say, oh, you can go to the doctor, that's great, but we don't cover the cost of prescription drugs. Cap of $200. How do we save money? Well, we do it on prescription drugs. We do it in a variety of ways. Number one, we have Medicare negotiate prescription drug prices with the drug companies. All right. Number two, we do pretty much what Canada does right now, is you take a look at what drug prices are around the rest of the world. You take 5 or 6 countries and you say to the drug companies, guess what? You're not going to charge us any more than you do on average with these other 5 or 6 countries. Number three, what you do is right now, as a result of that trip that I took to Canada 20 years ago, other members of Congress began to do it, senators began to do it, and right now, sad to say, there are millions of people who are buying prescription drugs abroad. What we should make legal is for your pharmacists and prescription drug distributors to be able to buy FDA-approved drugs in Canada and in other countries and sell them in the United States at a fraction of the price that they are now being sold. Fourthly, guess what? Your tax dollars have gone to develop many important drugs. And the drug companies use that research and then end up making as much money as they want. When taxpayers' dollars are used for research, we're going to have reasonable pricing on the part of the drug companies. Those are some of the things. I've been dealing with the pharmaceutical industry for 20 years. I am their worst nightmare.
All right, Senator, you said it earlier this week. You said earlier this week that Vice President Biden was sounding like Donald Trump and the healthcare industry when he was criticizing the Medicare for All, your healthcare plan. What did you mean by that, and what do you think is being distorted about your plan?
Well, I'll tell you, it's not just me. I think you may have noticed there are several PolitiFact groups. CNN did an article on this. Look, Joe is a friend of mine, and he has different points of view on healthcare than I do. That's great. We'll debate those issues. But we should not have distortions of what Medicare for All stands for. Joe talked about a hiatus. Was that the word that he used? In care. In other words, if you have a serious illness, as we transition to Medicare for All, there may be a hiatus. That is absolutely wrong. Of course, there will be a continuity of care. And that is what CNN and the PolitiFact media said as well, and experts said as well. So there will be no hiatus. People will obviously continue to get their care. And second of all, I think he suggested here as well that Medicare would go away, would not have Medicare. And that's wrong as well. Let me tell you what you would have. I am a strong defender of Medicare. Medicare is a very important and good and popular program for seniors. But let's be honest. Medicare does not provide all of the benefits that seniors need. Seniors need dental care. Medicare doesn't provide it. Seniors need hearing aids. Medicare does not provide it. Seniors need eyeglasses. Medicare does not provide it. Under Medicare for All, we expand those benefits to seniors. They are health care benefits, and they deserve it. Furthermore, we expand home health care. Millions of seniors would prefer to stay at home rather than go into a nursing home. They cannot afford to do that. They have to spend out everything that they've saved their lives. We fund home health care so people have the choice about staying home. So my only criticism of Joe on this one is he basically provided misinformation about what Medicare for All would do.
One of the objections to your plan, though, is that it's unrealistic to force millions of people to give up their private insurance if they like their plans. Medicare Part D, Medicare Advantage are also private insurance. What's your answer to that?
Well, let me answer it in a couple of ways. If I told you that the most you would pay in a given year for prescription drugs is $200, how does that compare to Medicare Part D? Pretty good, huh? Yes, it is. And furthermore, when we talk about the difficulty of a transition, I find that just really rather remarkable, and I really think it sells out the ability of the American people to do big things. In 1965, Lyndon Johnson in the Congress had a very radical idea. They said that we should provide a public health insurance program for people 65 or older called Medicare. Back in 1965, they did that without anywhere near the kind of technology that exists today. So if back in 1965 we could develop a brand new program and get it going within 1 year to provide health insurance for millions and millions of seniors, how does anybody think that over a 4-year period we cannot take an existing program, Medicare, and over a 4-year period provide health care to every man, woman, and child in this country? So let me tell you what we do. First year, we expand benefits to cover seniors, as I just mentioned, and we lower the eligibility age from 65 to 55. Not all that complicated, and we cover all the children. Next year, we go to 45. Then we go to 35. And then we cover every man, woman, and child in America. Let us be clear. The United States of America is the only major country on earth not to guarantee health care to all people as a right. We end up spending almost twice as much per capita on health care as do the people of any other country, and we pay by far the highest prices in the world for prescription drugs. It is time now to complete what they began in 1965. Medicare is a strong program. Let's expand it to every man, woman, and child in this country.
Senator, the Kaiser Family Foundation says about 12% of Americans in the workforce are working in the healthcare industry.
Yeah.
What happens to people who are processing payments for private pay? Where do those people go?
Well, hopefully, over a period of time, they will be transitioned into the healthcare system. And you asked a good point. When we talk about healthcare and healthcare workers, what do we want? We want people who are going to be doctors and nurses and nurse practitioners and do all the psychologists and psychiatrists, do the work that keeps people healthy or cures illnesses. That's what a healthcare worker should do. The reason we pay so much more than any other country for healthcare is we have an incredible bureaucracy, and we spend hundreds of billions of dollars a year on billing. So to be honest with you, if somebody is sitting there in an office telling you that, I'm sorry, you're not going to get covered for what you thought you would get covered, or telling a doctor you can't do this therapy or that therapy, that is not healthcare. That is denying healthcare. That is bureaucracy. That is a waste. So I want as many of those people as possible to get trained to provide healthcare to all people, not just sit around billing people. That's what we will be doing over a period of time.
One final question on this topic. As you know, some of your competitors have said if the party embraces Medicare for all, it will be a loser for the entire party in 2020.
Really? That's not the polling that I have seen. You know, I am told that everybody loves private health insurance industry. Oh, they are just so fond of Aetna and all these other major corporations. I don't believe that. I think people love their doctors, people love their nurses, people often have very good and positive experiences in hospital when they have to go there. To be honest with you, I have not talked to anybody who loves their insurance company. Because they understand. It's not, what is the function of a health insurance company? Thank you. To make money. It's not to provide quality care to you. And if they can deny you the benefit that you paid for, they make more money. You talk about people doing absurd work. There are people in the health insurance industry whose job it is to deny you the benefits that you paid for. That's a good use of health care money. All right? So what we ultimately want to say is not complicated. And again, my friends, not a radical idea. You go up to Canada. I live 60 miles away from the Canadian border. You have heart surgery. How much does it cost you out of your own pocket? Anyone know? Zero. You go to any doctor you want. You go to any hospital that you want. Because it is a publicly funded universal system that says whether you're rich, whether you're poor, whether you're middle class, you get quality care as a right, not a privilege. That is what the American people want. And those candidates who run on that program, who have the guts to take on the drug companies and the insurance companies, will win and win big.
Senator, you propose not only to save Social Security, but to reform and expand it. How does that work? Is it bigger checks, more recipients? What's the big picture?
Look, I have a radical idea. You ready for a radical idea? All right. This looks like a radical group here. Here's the radical idea, that at a time of massive income and wealth inequality, when 3 people own more wealth than the bottom half of America, when over the last 30 years, the top 1% has seen a $21 trillion increase in their wealth, while the bottom half of the American people have seen a $900 billion decline. You want my radical idea? That maybe we create an economy, a healthcare system, and a government that works for all people rather than just the 1%. All right, that's my radical idea. Now, what was exactly the question?
Social Security.
Social Security. All right, here is Social Security. My Republican colleagues, they have a brilliant idea. They have given $1.5 trillion in tax breaks to the top 1% and large private corporations. Massive income and wealth inequality, rich getting richer. What do they need? Massive amounts of tax breaks. Then they run up the deficit, And then they come back and they say, oh boy, we have a deficit problem. And the way we're going to have to deal with the deficit is to cut Social Security, Medicare, and Medicaid. How ugly is that? And what an absurd set of priorities is that? You don't give tax breaks to billionaires and then cut back on Social Security benefits for people trying to survive on $13,000 or $14,000 a year. What do? We do exactly the opposite. We say it is time for the wealthiest people in this country to start paying their fair share of taxes. In terms of Social Security, what do? We say, okay, Social Security will be fiscally solvent for the next, I think it's 17, 18 years, 16 years. That's not enough. It's solvent today, but we want it to be solvent into the future. What do? We do what is called scrap the cap. You all know what that is? Scrap the cap. Right now, you have a situation where somebody makes, I think, about $133,000 a year. They contribute into the Social Security Trust Fund exactly the same as somebody who makes $10 million a year. What we do is scrap that cap. We start at $250,000. That's the top 1% who are doing phenomenally well. They contribute more into the system. The result of that is we expand benefits for seniors, especially lower income seniors, people who are trying to get by on $11,000, $12,000, $13,000 a year. And equally important, we extend the life of Social Security for 52 years. That makes more sense to me than giving tax breaks to billionaires.
Go ahead, Tracy.
Senator, you have long been an advocate for legalizing marijuana.
Yeah.
Would you legalize it as president for both medical and recreational use?
Yeah.
Why?
I'll tell you why. Look, I have been a long-time advocate for reforming a broken criminal justice system. And at the heart of a broken criminal justice system is the so-called war on drugs, which, as many of you may know, has done devastating harm to millions and millions of people. And by the way, disproportionately impacting African Americans and Latinos and poor people. White people smoke marijuana at about the same level as black people. African Americans are about 6 times more likely to be arrested. So look, whether you like marijuana or you don't, and I'm not I've smoked marijuana twice in my life, I ended up coughing. That was what it did to me. So, I don't go around advocating for it. But I'll tell you an amazing thing, a funny thing. I was in Nevada a couple of weeks ago, and you drive down the street, and there's this big sign from some large corporation selling marijuana, literally advertising the sale of marijuana. So look, I think people have the choice. You want to do marijuana, fine. You don't want to do it, fine. But I don't want to see whole lots of people get arrested and thrown in jail because of the war on drugs.
You've got some coverage for long-term care in your Medicare
Yes.
for All plan. There are an estimated 7 to 8 million people who've been paying into long-term care insurance already. What happens to those policies? And you also keep Medicaid in place, is that correct?
Look, we have a real crisis in terms of both home health care and nursing home care. I mean, nursing home care is just outrageously expensive, and clearly we have got to do something about it. As many of you know, Medicaid, and we do keep Medicaid to pay for that, Medicaid pays a significant percentage of nursing home care in this country. But before you are eligible for that Medicaid payment, you have got to literally pauperize yourself. So just think for a moment. I was just talking to some folks earlier today. You work your whole life, you make some money. What do you want to do with the money? You want to leave it to your kids. But now you're forced to sell off everything before you're eligible for Medicaid and get that to help you get into a nursing home. We have to improve upon that. And the other thing that we have to do big time, what we do cover through Medicare for All, is home health care. As I think I mentioned earlier, most people would prefer, if they're able to stay at home rather than be forced into a nursing home. And the truth is, home health care is a lot less expensive than nursing home care. So we should be training a lot of workers to come into people's homes and to help them be able to stay at home, which is, I think, what they would prefer to do.
Senator, there are many Americans who use a reverse mortgage as a way to supplement their income in retirement. How would you regulate the industry as president?
Well, I can't give you any specific, that's not something that I've thought a whole lot about. But the issue that we should be talking about in a more, they do that because they're hurting financially. And I think it is time to take a hard look, and I want to congratulate AARP for what they are doing. So I think if you look at our program in terms of how it deals with senior citizens, what you will find is that Medicare for All will go a very long way to making life better and less expensive for seniors. Our home health care proposal will make it easier for people to stay at home. We will expand and extend Social Security. And by the way, there's another issue I want to mention on Social Security. And that is right now, COLAs, the cost of living adjustments, are often inadequate and often not based on a fair description of what inflation is. Right now, what we do is we look at the whole population in determining what inflation is, and then that's what the COLA is that seniors may get. But the truth is that seniors' purchasing practices are very different than the whole population's. Seniors will spend more money on health care. They'll spend more money on prescription drugs, which are going up a lot faster than computers and widescreen TVs. So what we need to do, by the way, is segregate the index for senior inflation, which will mean a higher cost of living adjustments.
Senator, another issue with long-term care is that there's just a severe shortage of workers for nursing homes, for in-home care. What would you do about that?
Well, what we would do is determine how we can pay those workers who do enormously important work. I mean, we have things really kind of upside down. We have 25 hedge fund managers in America who make twice as much money as all of the kindergarten teachers in this country. All right, that's a little bit absurd. I'm not quite sure what hedge fund managers do that is productive, but they sure do make a lot of money. I do know what home health care workers do, and that is enormously important, and I've met many of them. They are compassionate, good people who make terrible, terrible wages, often don't have the health care benefits that they need. So when we talk about changing priorities in America, it means helping and supporting those people who do some of the most important work. Who are those people? They are child care workers who are underpaid, don't have benefits. They are home health care workers. They are teachers who do some of the most important work in this country and are not adequately reimbursed. So part of what we are trying to do and what our entire program is about is changing priorities in America. It's the saying that in an aging population, we all want well-trained, compassionate, good people to be able to come to our homes to help us when we need that help. That's difficult work, sometimes emotionally draining work. Those people deserve to be adequately paid. And I'm very proud, by the way, as somebody who led the effort to raise that minimum wage to $15 an hour that had just passed in the House the other day. We've got to get it passed in the Senate now.
Senator, this will be the last question, and we don't have much time left. Broadband is inaccessible in many areas. Folks often can't even afford it if it is available. How would you regulate the industry?
Look, it's not a question of even regulating the industry. It's a question of making sure that in this country, and this is especially true for rural America. I mean, if you were you get me going on this one too. I mean, in rural America, we're seeing in many counties a decline in population. Schools are being shut down. Downtowns are being boarded up. I come from one of the most rural states in America. I think the rural way of life is a good way of life, but it has to be supported. Instead of shutting down rural hospitals, why don't we make sure that all people in underserved areas have the health care that they need? If you talk about economic development, how do you have economic development in a small town if you don't have good quality cell phone service and good quality broadband? We invest in those things. God, I mean, it's really quite unbelievable that in the year 2019, in rural community after rural community, people do not have high quality, affordable broadband. This is the United States of America. We could do that.
Senator, thank you so much for, I'm going to give you 30 seconds, though, to wrap up. So thank you for answering our questions, but you can have 30 more seconds to wrap up.
Look,
Not kicking you off yet.
we are the wealthiest country in the history of the world. We're not a poor country. But we have got to learn to think big and not small. And that means telling the pharmaceutical industry they're not going to rip us off anymore. Telling the insurance industry that the function of healthcare is to provide healthcare to all, not to make billions in profit for the stockholders and the CEOs of those companies. So as a nation, and what this campaign is about, and it's what I mean when I talk about us, not me, no president can do it alone. We need millions of people to stand up in the fight for economic justice, for social justice, racial justice, and environmental justice. By the way, yeah, maybe we should tell the fossil fuel industry that they cannot make billions while they destroy the planet, in passing, of some significance. So what we need to do, it's not radical. It is creating a government which does what the American people want. The American people want health care for all. They want decent wages for workers. They want to tackle climate change. They don't want to get ripped off by the pharmaceutical industry. They want a criminal justice system which does not have more people in jail than any other country. They want real, comprehensive immigration reform. They want good schools for their kids and well-paid teachers. These are not radical ideas. These are ideas that are supported by the American people. Problem is, in Washington now, you got a corrupt political system. And you have a situation where Congress listens to the very wealthy campaign contributors who fund their campaigns. I am proud to tell you that we have now received 2 million individual contributions for our campaign. That is an all-time world record. That's the good news. Bad news is the average contribution is all of $19. But I'm proud of that too, because that means that working people and poor people are contributing. So, look, we are living in dangerous and difficult times with a dangerous president. And I think it is time that we had a government that works for all of us, not just the few, a government which brings us together, not tries to divide us up. So let me conclude by thanking you and thanking AARP for all the great work you're doing. And as president, I will look forward to working with you all. Thank you.